A rise in COVID-19 cases turns into more people needing treatment in hospitals. That's what's happening in Oregon. The state is broken into 7 regions where healthcare workers are fighting the disease. We looked at Region 7 today. It's the biggest geographically, Central Oregon all the way south. Today, about 4 out of 5 hospital beds are occupied, and over 60% of ICU beds are in use too. 15 patients confirmed with COVID-19 are part of that hospital population.
We are, of course, concerned that if we don't take some intervention and ask for the help of our communities to help in this regard, we're concerned that the numbers will rise.
Dr. Jeff Absalon is Chief Physician Executive at St. Charles Health System based in Bend. He says they're managing now, but concerned about what could come. One bright spot is the supply of personal protective equipment. It looks pretty good across the state.
We don't have wide open supply chains, but they're certainly much better than what was the case earlier in the pandemic.
St. Charles has a mostly good supply of face masks, gowns, N95 respirators, surgical masks, and gloves. You can see the day's worth of each listed here. But if things get busier, supplies will go faster.
If we see a surge of patients, it is very possible that we will need to utilize that PPE at a higher rate. So it's something we keep an eye on a regular basis. But again, it's not at the same level of concern that we had early in the pandemic.
The biggest concern is for healthcare workers themselves. If COVID case numbers climb too high, there won't be enough of them. And the ones working on the front lines will have trouble keeping up.
Our caregivers are here every day to take care of sick people. If our communities can do their part to prevent the spread of this virus, you are directly helping healthcare workers.
Tim Gordon, KGW News.